السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا راح تكون عن الماستيغوفورا تكملة للمحاضرة السابقة. تكلمنا في المحاضرة السابقة عن البلانتيديوم which it is the cellated protozoan and the mastigophora or flagellate protozoa that are present in the intestinal canal of a human, the lumen dwelling flagellate or mastigophora. وتكلمنا فيها عن الكيلوماستكس and dientamoeba. قلنا both of them they are commensal amoebae, produce no infection, but dientamoeba have the ability and sometimes maybe produce a mild infection within a human. Today we are talking about the third example of the a flagellate that are present in the intestinal canal of a human, which it is the Giardia Lactose and the genital tract flagellate, the Trichomonas vaginalis. قسمنا بالمحاضرة السابقة أيضا شفنا أنه the as subphylum Mastigophora are divided into two groups, the lumen dwelling flagellate, وتعرفنا على الجيارديا لامبليا, dientamoeba fragiles, kilomastics مثلا, Trichomonas homines. All of them are present in the intestinal canal of a human, and the Trichomonas tenax present in the oral cavity, and the Trichomonas vaginalis in the urogenital tract. And we have the hemoflagellate, and we have two important examples, Trypanosoma and Giardia Lactose. This parasite produce infection within intestinal canal of a human. It is present in the small part of intestine. It is also known as Giardia intestinalis. الاسم الثاني إلها Giardia intestinalis. بعض الكتب تذكرها بهذا الاسم. or it is known as Giardia lactose. التسميتين هي نفس الشيء. Giardia lactose, it is a protozoan flagellate. It exists in two morphological forms, the motile vegetative stage known as trophozoite, and the cyst stage, which it is the infective stage of the parasite. Both of them are seen in the small intestine of a human, and this intestinal parasite is common in wild animal. It is known as the infection that arises from this parasite known as beaver fever, اللي هي يسموها بحمى القندس. القندس هو نوع من أنواع الفرائيات مثل السنجاب، شبيه بالسنجاب إلى حد كبير. كانوا في غابات أوروبا يطلعون إلى الغابات يصطادوا، صيادين يصطادون الفراء على مود يبيعوها لأنه ثمنه كلش غالي، فكانوا يطلعون إلى هذه الغابات. فمن عندها يعني نتيجة أنه contact with these animals, the parasite it is transmitted to human and to produce infection. ومن الصيادين اللي كانوا يصطادون القنادس حتى يحصلون على الفراء مالتها، من عندهم انتشر إلى باقي أوروبا ومنه إلى العالم كليته. فيعتقد أنه أصل المرض هو في البيفر أنيمال يسموه، أو القنادس، هي اللي تكون يعني أول الحيوانات اللي كانت مصابة بها، فمن عندها انتشر أو انتقل إلى الإنسان. هذا واحد من الاعتقادات اللي كانوا يعتقدوها يعني أو هي يعني أصل أو نشوء المرض. تنطيني نشوء المرض. The trophozoite of this parasite it is very easily distinguishing from the other flagellate. This parasite have a pyriform كمثري شكل with a flagellum present within it. It's pyriform يعني كمثري. It have a rounded, a broad anterior portion and tapering narrow posterior portion. It is have a convex structure. From the dorsal side it is convex, and from the ventral side at the interior part an adhesive disc present. Adhesion disc or adhesive disc or a tapping disc are present in the anterior portion, Within this adhesive disc, two nuclei are arise and a median body cleft present in the middle part of the organism. From the ventral view, it's like a face. It's like the structure of face. لما نبوع من المظهر البطني كأنما شكل الوجه. From the ventral side في المنظر الجانبي مثل يشبه الطيارة الورقية. And here we must know that the adhesion disc or adhesive disc or sucking disc that are present in the ventral side of the anterior part of the parasite, it is very important in the pathogenesis that arises from this infection, because it is enable the parasite to adhering themselves to the mucosa of a small intestine and forming of a basement membrane. Basement membrane يعني بشكل بلاط يبلط الميوكوزا of a small intestine. من يبلطها راح يمنع الامتصاص، راح يمنع digestion of the lipid and other symptoms or pathological alteration that we are discussed in other slides. As we mentioned, the most important feature is the presence of the adhesive disc in the anterior part, and this parasite have a bilateral symmetry, bilateral symmetry تناظر ثنائي عنده. هذا أهم الأشياء. And the moving of this parasite is like falling leaves، مثل كأنما سقوط الورقة من الشجرة يتحرك بهذا الشكل. And the parasite is present in the small part of intestine at the duodenum or jejunum of the small part of intestine. This figure showing the parasite, the trophozoite of the parasite. ونشوف الادهيسيف disc وموجود هذا النيوكلياي with very large caryosome in the side of the nucleus. ينطيني انطباع انه شكله شكل الوجه. This figure represents the parasite from high magnification power to showing the adhesive disc at the anterior part, which as mentioned it is very important in the pathogenesis of this parasite. وهذا اللي راح نشوفه في السلايدات القادمة لما نتكلم عن الباثوجينيسيس of this parasite. Another figure showing the parasite bathing the mucosa of a small intestine. It have a convex dorsal part. يكون شكله محدد بالجزء الظهري والجزء البطني فيه موجود الادهيسيف. Another figure showing the parasite, the colony of the parasite within the small intestine, and this parasite bathing the mucosa of the small intestine. The cystic stage of this parasite is oval, containing of 4 nuclei. In the trophozoite, 2 nuclei present, and in the cystic stage 4 nuclei are present, and other morphology you can read it. But the most important features of this stage are destroyed by the chlorination of the water. It is very important features in the spreading or prevalence of the infection in our world. This stage cannot kill by the chlorination of the water. يعني في كل سهولة ممكن إنه هذا الباراسايت يجيك عن طريق التاب water, because the chlorination of the water of the tap water, it is enough to destroy this parasite at this stage or kill this stage. And it is have the ability to survive several months in cold water. فهذه صفة جدا مهمة. It is considered as a waterborne in addition to foodborne infection. ممكن انه ينتقل عن طريق الماء، ممكن انه يعيش فترات جدا طويلة في المياه الباردة، فهذه صفة جدا مهمة، بالإضافة إلى كونه أنه ما ينقتل بالكلورين اللي موجود في التاب ووتر. فهذه صفتين جدا مهمة. And the distribution or prevalence of the parasite in worldwide. This figure showing the fifth stage of the parasite, which is have an oval in shape, and this figure also showing the trophozoite and the fifth stage of the parasite. Regard to the life cycle of this organism, as we mentioned, this parasite presents into two stages of trophozoite and cyst stage. Both of them are found in the small intestine, and both of them may be passed with the feces of the infected person. In this regard, we can consider the trophozoite and cyst as a diagnostic stage of the parasite. The trophozoite within the small intestine, as we mentioned, it is bathing the small intestine and produce a colony by reproducing by a binary fishing. عن طريق الانشطار الثنائي, the binary fishing lead to or enable the parasite to bathing the intestinal canal or the mucosa of the intestinal canal. After several round of the binary fishing, some of the trophozoite transformed into cyst stage, and both of them pass with the feces of infected person. Then upon they are reaching the water or food of another person, the contamination occurs by the cyst. The cyst, it is responsible for transmission of infection. It is the infective stage of the parasite. When it is ingested by a suitable host with contaminated food or water, excitation occurs in the intestinal canal, and the parasite transforms into trophozoite, and this is trophozoite, as we mentioned, colonizes the small part of intestine. The pathogenesis that arises from such infection have many spectrum. May be produced asymptomatic or symptomatic infection. Symptomatic infection present in about 50% of infected person. يعني نص اللي يصابون ممكن انه تظهر عليهم الاعراض، النص الاخر ما يكون عليهم اعراض. And the symptoms including diarrhea and malabsorption, which it is the malabsorption, it is the important symptoms or feature of the infection with the Giardia Lactose arise from the bathing of the mucosa of the small intestine. The trophozoite, as we mentioned, it is not invade the tissue, but it is bathing the mucosa or covering the mucosa of small intestine and lead to malabsorption as a result to this criteria. The bathing of the mucosa of small intestine by the parasite. As we mentioned, here the colonization or the bathing of the small intestine, mucosa of small intestine, it is result in inflammation and villus atrophy, functional derangement of the epithelial cell of the mucosa, reducing the gut absorptive capability and reduce the fresh border enzyme and end with malabsorption. This figure showing the crypt in the above figure showing the crypt hyperplasia and the atrophy that arise from the infection, and the image below showing the normal small intestine mucosa. The acute stage of infection is developed this infection have an acute and chronic stage of infection. The acute infection is developed after an incubation period between 1 to 14 days, and the symptoms include very two symptoms are arise from the infection, which it is the sudden exclusive watery diarrhea, and it is a foul smelling. Foul smelling and exclusive watery diarrhea, it is two important symptoms of the infection. Exclusive watery diarrhea meaning يعني احكيها في العربي واسف على الوصف، لكن لما الشخص يكون مصاب لما يقعد بالتايلت سيت يعني سوري ينزل الخروج بشكل كأنما مثل القنبلة اللي حتنفجر رأسا مرة واحدة، والعفو طشر على التايلت سيت على التواليت كليتها تغطيها وفي رائحة كريهة جدا. هذه أهم صفتين or symptoms of the infection with this parasite. The stool the stool are generally described as loose, bulky, frothy بهاي الغازات الكثيرة اللي تصير and or greasy with no blood or mucus. greasy نوقف عندها greasy يعني موجود دهون بيها، وهسه نشوف انه ليش بيصير هذه الحالة. greasy because there is no digestion of the lipid. فاللipid droplets pass with the feces or with the diarrheal stool of the infected person. هنا احنا يعني الاطباء الاطفال يسالوها للام يعني يصاب الاطفال بكثره في هذا الباراسايت، فيسالوها للام من تغسله اكو بيدهن الستول اكو بيدهن. فهذه وحده من الصفات اللي from the clinical sign we can prove that the infection is with Giardia lumbria. Okay, there is no blood or mucus because the parasite cannot invade the mucosa of the small intestine. It is bathing the mucosa of a small intestine, and this symptoms accompanied by the nausea, colicky, epigastric pain, upper gastro-intestinal uneasiness, bloating والانتفاخ نتيجة الغازات اللي دا تصير. flatulence هو التطبيل، ويعني ماكو من يضرب على بطنه اكو هذا الصوت اللي يطلع مثل الطبل كأنما نتيجة الغازات اللي دا تصير. vomiting and or prolonged belching هذا يتريع دائما يتجشأ، وحتى ريحة التريوعة مالته تصير بيها شوية يعني ريحتها مو مضبوطة. Loss of appetite and weight, it is another very important symptoms of the infection with this parasite. The acute stage are usually resolved spontaneously in 3 to 4 days, and in some person maybe this acute infection undergo the chronicity of the infection. Occasionally in the acute infection when it is persist for very long time, it leads to malabsorption and dyspepsia. Malabsorption and dyspepsia, very important features of the persistence of the infection with this parasite. There is an excessive loss of fat in the feces, debility and loss of which it is meaning loss of strength and losing of weight. It is other features of infection. Steatorrhea, this state arise from the intake of the parasite, the steatorrhea. It is a state that arises from the utilization of the parasite to the bile duct of a human, and it is to prevent the activity of the pancreatic lipase. هو يمنع عمل البنكرياتيك lipase by utilizing the bile salt for its own growth. This parasite takes the bile duct for its own growth, and in this manner is lead to a state of steatorrhea because the Lipid droplets are passed with the feces, not digested, and passed with the feces of the infected person. Some person may be undergo chronic infection, and in the chronic giardiasis is characterized by recurrent brief episode of gastro-intestinal symptoms, recurrent diarrhea and malabsorption, particularly of fat and carbohydrate, and debilitation may be also occur. Malabsorption is arising from the leaving of the mucosa of the small intestine by the parasite، فهي تمنع امتصاص الماء فتطلع عندي يصير عندي diarrhea with lipid droplets as a result to prevent the parasite the digestion of the lipid because it is utilize the bile salt for its own growth. Another symptoms may be arise in the chronic stage of infection, which include marked weight loss and sometimes associated with chronic infection. Maybe associated. Some person after the course of infection or during the course of infection may be develop a syndrome known as Post-Giardia Lactose Intolerance. This syndrome are developed by some patients. Some person have this syndrome, which it is known as Giardia lactose intolerance. Lactose intolerance, as we know, lactose, it is sugar that are present in the milk, and this sugar it is digested by a lactase enzyme. The parasite produce a state of lactase deficiency. It is prevent or inhibit the production or the synthesis of the lactase enzyme. In this manner, there is no digestion of the lactose, and some person are predisposing for intolerance of the lactose. فيصير عندهم عدم تحمل لللاكتوز. In this manner, this syndrome will be arise. The epidemiology of this parasite are important features present in the infection with this parasite. First of all, the cystic stage of this parasite, it is cannot killed by the ordinary chlorination of the tap water. هاي أهم صفة إنه ما ينقتل بالكلورينيشن. هاي كمية الكلورين اللي موجودة بالتاب ووتر غير كافية إنه تقتله. And the cyst is passed with the feces of infected person, and it is considered as a fecal-oral infection. And in addition, direct person-to-person contact may be transmitted the infection to another person. Ingestion of contaminated food or water, it is also serve as other route or mode of transmission. Waterborne, it is very important feature of infection with the Giardia lamblia. Waterborne outbreaks may be occur around as a result of contamination of multiple water supplies with the cyst stage of the parasite. فقلنا ان the cyst stage have the ability to survive or remain viable for several months in a cold water. فهاي صفة كلش مهمة as we mentioned in the transmission or prevalence of this infection. The infection occur more frequent in children in institution and in the large families. All ages are affected. Infants and young children have an increased susceptibility to giardiasis, and the age-specific prevalence of the giardiasis is highest in the childhood and adolescence, and then begins to decline thereafter. The diagnosis of this infection, it is easily achieved by identification of the trophozoites and cyst stages in the feces of infected person. يكفي انه اشوف التروفوزويت or cyst اقدر احدد انه الاصابه في الجياردياسيس. In addition, another test known as anterior test using a string device. By this device we can easily diagnose the infection with this parasite. This test is based on the using of a gelatin capsule. This gelatin capsule bound with a string of an appropriate length. The free end of the string are taped on the face of the infected person, and the capsule, gelatin capsule, are swallowed by this patient. يبلع الجيلاتينة وتبقى انه السترينج او السلسلة اللي هي عبارة عن سلسلة نايلون تربط في وجه المريض، وتبقى إلى فترة محددة between 4 hours or overnight. Then this string are taken from the patient, and the bile stain portion of the capsule are scraped and making a slide. This slide are identified or examined under the microscope to see the trophozoite or the cyst stage of the parasite, and it is very important test in many parts of our in the world. وبكل سهولة إنه أقدر أحدد الإصابة عن طريق using of the elimination of infection. Thank you very much. أرجو أن أكون وفقت في إيصال المعلومات بصورة سلسة وسهلة لكم. تمنياتي لكم بالتوفيق. Trichomonas species. This genus, it is very important, containing 3 species. 2 of them may be present either in the oral or intestinal canal of a human, but the third, which it is commensal there, and the third species known as Trichomonas vaginalis, it is only the pathogenic species of the parasite to produce infection in man and women equally. It is a flagellated protozoa of the intestinal and urogenital tract. It is present in the trophozoite stage only. There is only a trophozoite stage in their life cycle. There is no cyst stage for this parasite. It is not detected yet now. They are rounded anteriorly and pointed posteriorly. واحنا مثل ما نجي عليها اذا اكو اشياء مهمه راح اذكرها يعني سريع يعني انبه عليها. احنا المورفولوجي ان شاء الله راح ناخذه في كل تفصيلاته في العملي باذن الله ان شاء الله. Very important feature for this parasite is a 5 flagellate emerge from the basal bodies at the anterior pool of the parasite, and one of these flagellum are retracted backward again to forming an undulating membrane, semi-bal undulating membrane, and until they are from the anterior part, it is retracted to the posterior part, and it is forming a wavy membrane known as undulating membrane. نسميه هذا الغشاء المتموج. هذه موجود فيه من المقدمة يبدي إلى النهاية. هذا فد صفة جدا مهمة في الترايكوموناس as a genus. Okay. This image represents the morphology of the trophozoite and all internal features واللي قلنا حنجي عليها في العملي إن شاء الله بكل تفصيل. The Trichomonas containing three important species. Trichomonas tenax, it is present in the oral cavity of a human. Trichomonas hominis, it is present in the intestinal canal of a human. And this parasite في سابقا كانوا يسموه بالبنترا ترايكوموناس. سابقا كانوا يسموه بالترايكوموناس بنتا ترايكوموناس. فهذه هي تسميات animator يعني ما تهمنا كثير. And the third example, which it is a very important species, it is the Trichomonas vaginalis. It is a pathological species produce urogenital tract infection in a human in both men and women. Trichomonas tenax, as we mentioned, it is present in the trophozoite stage only. It is commensal in the mouth cavity of a human. It is smaller than Trichomonas hominis, animator, undulating membrane, short, exostyle protrude well beyond the posterior end. Animator هذه كلها morphology ما يهمنا. It is a commensal organism. لكن وجوده هو ينطي give an indication about the low hygienic process of the person. يعني عندنا انه هو commensal ما صح ما يسبب امراض، لكن وجوده بالفم انه دا يبقى هذه فتره طويله وهذه معناها انه there is a poor hygienic process for this person. The Trichomonas hominis, this parasite present in the colon of the person. It is present in the trophozoite stage only, have a marginal flagellum extended beyond the posterior end animator. كلها هذه morphology ما هذه. And the Trichomonas vaginalis, it produce infection known as Trichomoniasis vaginalis or Trichomonas vaginitis. It is produce vaginitis within women, and it is also produce infection in the men only. In the men also. It is produce infection in both sexes, in the male and female. It is a flagellate, is the most important pathogenic protozoan of a human's venereal disease. يعني نكاد نجزم هذا هو الباراسايت الوحيد اللي يكون في sex organs produce infection in the genital tract of both male and female, and it is a sexual transmitted parasite. It is one of the sexual transmitted infection. This parasite are known as a sexual transmitted parasite, and it is one example of the venereal disease, all the sexual transmitted infection. Okay. بالإضافة احنا عندي أعداد كثير من البكتيريا that are produce infection in the genital tract, and it is considered as a sexual transmitted infection. This figure represents the morphology of the parasite. احنا قلنا حنجي بتفاصيلها فما راح ادوخكم بيها، انا يعني حكيت تقريبا هواية اشياء من ادها. انيماتر راح نقلبها. الاشياء المهمة فيها have a jerky non-directional motility. It is very important feature in this parasite. Jerky non-directional motility يعني يتحرك في داخل الفاجينا or the urethra of the infected person in the genital tract of infected person, whether it is male or female, in a jerky non-directional motility. يعني شو معناها؟ like the mad dog، مثل الكلب المجنون، يتحرك بكل الاتجاهات، عنده حركة جدا سريعة ويتحرك بكل الاتجاهات. هاي الحركة تسبب urticaria حكة or itching in the genital tract، فهي نتيجة هاي الحركة سبب لي itching in the genital tract of infected person. بقية الصفات يعني مثلنا اللي يهمنا فيه هو أنه it is transmitted by the sexual intercourses، وهذا الجيركي موفمنت اللي تسبب لي هاي الاتشنج في الجينيتاليا of a human. This diagrammatic life cycle represents the life cycle of this parasite. The parasite, as we mentioned, it is found in the genital tract of both male and female, and it is transmitted by the sexual intercourse and the oral sex, and in addition to the sharing of the wet towels maybe or underwears maybe transmitted the infection. وهاي هي حالات جدا نادرا انه ماكو اشخاص يعني يتبادلون هذه الاندرويرز بين يعني بيناتهم، او انه ممكن هو حالة هي نظريا يعني لكن غير موثقة. using of a toilet set may be transmitted this parasite. اكو يعني مو كل شيء موثقة انه ممكن الاستعمال التويلت ممكن انه ينقل لي الباراسايت او استخدام المناشف المبللة. هي هذه ممكن هذه المناشف المبللة ممكن انه يعني تنقله بصورة كلش كبيرة ايضا، اللي هو another mode of transmitted of this infection not only via the sexual intercourse. In addition, it is kind of transmitted by sharing of the underwears or the towels. هذه المناشف ممكن انه تنقل لي من الشخص السليم المصاب الى السليم. The parasite, as we mentioned, it is present in the genitalia of a human. It is reproduced by binary fishing اللي هو simple mitosis. It is present in the trophozoite stage only. Okay, فعندي التروفوزويت it is serve as the infective stage and the diagnostic stage of the parasite. هاي كل دورة حياته للباراسايت as we mentioned their mode of transmission as عرفناها انه شلون. فدورة حياته life cycle it is very simple of this parasite. This it is represent متأسفة the proportion of asymptomatic trichomoniasis in both women and men. شوف هنا احنا هي الجزء الأحمر بالنسبة للمين represent the proportion of the asymptomatic infection. It is produced an asymptomatic infection in a majority of infected males. في غالبية الرجال اللي ينصابون تكون الإصابة مالتهم هي asymptomatic. And in the women بالعكس 73% of the infected women exhibit or develop symptoms. It is produce symptomatic infection in the majority of women. هنا نرجع في الرجال يسبب لي غالبية الإصابات تكون asymptomatic, while in the female on the women the majority of infection it is symptomatic. The pathogenesis of this infection, the Trichomonas vaginalis as a parasite, as we mentioned, despite its name it is infect both men and women. هذا احنا حكيناها. The incubation period of this infection it's between 5 to 28 days. The infection in the women it is frequently symptomatic, and these symptoms include vaginitis with purulent frothy discharge, which it is either yellowish or greenish. عندي اللي هاي أهم علامة، يعني مو أهم علامة، واحدة من العلامات المهمة إنه تسبب لي purulent frothy discharge. Purulent frothy discharge which it is either yellowish or greenish. يعني يكون frothy مثل كأنما الديسشارج يعني هذه إفرازات فقاعية مثل بيها مثل كمية كبيرة من الهواء مثل الفقاعات بيها with the discharge. هذه it is one of the main symptoms arise from the infection in the women. هاي احنا بدنا نحكي all the symptoms in the women. In addition, vulva and cervical lesion may be developed after infection, which it is known as strawberry cervix. Strawberry cervix and the frothy discharge, those two symptoms are very important symptoms that are give an indication or indicator about the infection with this parasite. فهي من العلامات اللي جدا مهمة انه وجود الستروبري سيرفكس. يعني شنو ستروبري؟ عنق الرحم في النساء المصابات كأنما شلون الفراولة بها هاي الندب اللي هاي الفراولة عليها مثل هاي البذور مالتها اللي تكون لونها غامق او اسود، بالضبط تكون السيرفكس of the infected woman like this strawberry. موجود عليها هذه النقاط اللي تمثل ال patches of the colony of the organism، بالإضافة إلى ال frothy discharge اللي يكون لونه إما يكون لونه على صفار أو على خضار. فهذه هي اثنيناتها من العلامات المهمة جدا اللي رأسا فقط بالفحص رأسا تعرف أنه الطبيبة أنه المصابة بالترايكوموناس فاجيناليس. This figure represents the frothy discharge on the strawberry cervix in the infected women. هذه اللي نشوفها على جهة اليمين اللي هي كأنما شلون هذه الندب اللي نشوفها نقاط غامقة أغمق من البقية. It represents the colony of the parasite، وعلى اليمين هي ال frothy discharge. شوف الكمية الفقاعات اللي موجودة فيه. Itching, burning or pain in the vagina and musty vaginal odor, it is also occur. يعني خلال الفحص يعني الطبيبة لما تفحص يعني الأودر ريحة الفاجينا ريحتها جدا عفنة. فهذه أيضا it is another important symptoms about the infection with this parasite. In addition, abdominal pain, dysuria, which it is a painful urination, may be occur in some infected women. It is followed by urination more than of usual. فحيصير عندها كمية إدرار أو تحتاج للحمام يعني في فترات متقاربة جدا. هذه واحدة من العلامات اللي تصير عندي. Dyspareunia, it is also occur, which it is represent a pain or discomfort during the sexual intercourse نتيجة وجود الباراسايت في هذه في الفاجينا. And an elevated vaginal pH may be occur as a result to discharge of or the formation of the amines as a byproduct of the metabolic of the organism when it is when it is infected the women. The clinical symptoms that are present in the infected male including urethritis, epididymitis, and prostatitis. It also can occur in the asymptomatic infection. احنا قلنا a majority of the infection within the male it is asymptomatic. In addition, the symptoms also include thin whitish urethral discharge, dysuria, which it is commonly asymptomatic, and the parasite can be isolated from men with chronic prostatitis. هاي في بعض الحالات واللي هي حالات قليلة انه have a prostatitis, chronic prostatitis. بعض الحالات انه عزوا الترايكوموناس vaginalis from such infection. The diagnosis is by demonstration of the parasite microscopically in the vaginal or urethral discharge in the women or in the urine sediment. Vaginal or urethral, في infected person or in the urine sediment. اليورين أيضا شافوا أنه It is valuable. It is very important in the diagnosis of the parasite. Pap smear. It is an smear which it is very important in the diagnosis of the Trichomonas vaginalis. باب سمير هي هذا مختصر هو طوره طوره أحد الأطباء اليونانيين اللي في أمريكا طوره وسمي على اسمه بالباب سمير. It is a smear or a scrub from the vaginal or urethra of infected person ويسووه بشكل سمير وتصبغ بالهيماتوكسيلين والأيوسين. It is very useful in the diagnosis of Trichomonas vaginalis. As we mentioned, this smear or this method of diagnosis, it is developed to identify any abnormalities in the vaginal smear of infected women. هو كان انه طوره في البدايه حتى يكشف عن كل الاحتمالات ال CA of the vagina. فطوره انه حتى يشوف هذه الخلايا اللي الابيثيليا that are epithelial of the vagina. فطوره انه ياخذ فيها سكراب فتقشطه من الفاجينا وتصبغ بالهيماتوكسيلين والايوسين. فبعدين في باستمرار الزمن هي it is very useful for the diagnosis any abnormality, any abnormal reproduction for the epithelia in the vagina. هي كلش ناجح في انه يكتشفها في بداياتها لكن بعدين ايضا اكتشفوا it is very useful for the diagnosis of the infection whether it is which it is either it is parasitic or bacterial infection. فلقوها انه ايضا ممكن انه يشخصون بها الباراسيتيك انفكشن واللي هو التراكوموناس فاجيناليس. The treatment is by metronidazole, which it is very useful in the elimination of infection, and the control is by personal hygiene or treating of infected person and avoiding of coitus with infected partner. It is very important in the elimination of infection.